Hey everyone, my name is Dr. Gayla Tia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our content at sptwithme.com. Now, for what you're actually here for, let's talk about the open packed position. The open pack position is a very specific position that you can place a joint in so that the entire joint is the most lax and has the least amount of congruence. Congruence means how well structures fit together, and structures means the articulating surfaces of the bones. So as I said, the position is the least congruent. So out of all the angles of a joint, this is the specific one where the two articulating surfaces fit the least well together. Now, of course, our bones don't change shape as we move through a range of motion, but think about the difference between a ball and socket that is placed super close with each other and fits like a glove, compared to if the same ball and socket is a little bit more spaced out. So the structures are the same, but the space between them makes it more or less congruent. So what makes this ability to be more congruent or less congruent? Well, like I mentioned before, this is a position that provides the most amount of laxity. When we're talking about laxity, we're talking about the surrounding soft tissue structures. So think about the capsule and ligaments, etc. So there's a specific point, for example, in our shoulder range of motion or our elbows range of motion or knee range of motion that makes these surrounding soft tissue structures just a little bit more lax and loose compared to other positions. So if you consider how bones are held together, they're not just floating in space. They're held together because of the surrounding soft tissue structures. They're held together because of our ligaments. They're held together because of our joint capsule. So if our soft tissue structures are tight, then the bones are going to be pulled together. But if they're looser, such as in this open pack position, the bones are going to end up drifting away from each other. Now, when I say loose, we are not talking about an abnormal loose. It's not a torn capsule or something torn like a ligament, right? It's a normal loose. It's normal. It's not like the degree of looseness causing a joint dislocation, because that's not normal. A normal loose. As mentioned before, this is a position. This is not a movement. So for example, let's say the humeral ulnar joint. You know, the exact position that this joint has to be placed in to be called the open pack position. It's specifically at 70 degrees of flexion and 10 degrees of supination. They have to be combined. So if you place your patient in 70 degrees of flexion but 5 degrees of supination, this is not considered the open pack position. Let's talk about what I mean when I say give. Now imagine the anatomy of our tibiofemoral joint. So we're talking about the knee. So in your head, I want you to picture the femur bone, the tibia bone, and they're connected. However, of course, we have other structures. We've got the meniscus and the ACL and the PCL, the MCL, the LCL. You know, we have a joint capsule. There are a lot of structures and soft tissues that are surrounding the joint. Now, let's say you're flexing and you're extending the knee, whether it's your patient or you yourself. There are going to be certain ranges that you go into that feel a little bit more tight, while others feel a little bit more loose. And when I say loose, I'm not talking about instability, but maybe just the sensation of feeling a little bit of pressure. So if I have my knee completely extended and my screw home mechanism is turned on, so I'm at end range with my tibia externally rotated, this to me feels tight. But then if I relax it a little bit and allow my knee to breathe and bend, it kind of does feel a little bit looser. If I continue to flex my knee until it's very end range of knee flexion, it kind of feels similar to how it feels at the end range of extension. It feels tight. The second position that I mentioned, the one where my knee feels like it can breathe and it's a little bit more relaxed, this is the open packed position. So this is a very specific position where we can place our knee joint in, providing the most amount of space between the bones. So for example, let's say I took an x-ray of your knee at 25 degrees of flexion, and I took an x-ray of your knee at 0 degrees of extension. You're going to see that there is a literal physical difference in the amount of space that there is between the two bones. 25 degrees of flexion is specifically the open pack position. So at this position, all of your soft tissue structures are lax, and that's what allows this to have a little bit more space. But at other positions like 24 degrees of flexion or 26 degrees of flexion, it is going to bring the bones that much closer. Now, it might not seem such a significant difference. However, the 25 degrees of flexion shows that it has the most out of all the ranges that we have in our knee to where the space is at its peak. I've said this a couple times already. Just remember that we do not have floating bones. All right, what holds our bones together are the surrounding soft tissues, capsule, ligaments, etc. So when our tibia and our femur are the farthest apart from each other, that just means that these surrounding soft tissue structures are lax, they're relaxed. Because if they were tight, then it would show, it would pull the two bones together. But again, in 25 degrees of flexion, just because of this highest level of laxity, the bones are able to separate as they do. Laxity does not mean instability. This is a normal looseness. It just happens to be the most within this range. Each joint that we have in our body has a unique open pack position. It's going to depend on the shape of the joint, the position of the surrounding structures, and how much free range that joint has, among other things. So with that being said, just because the knee's open pack position is at 25 degrees, that doesn't mean that it's the same thing at the shoulder joint, that the shoulder joint is at 25 degrees, or that the MCP or DIP, they're all at 25 degrees of flexion. No, they are all very unique, dependent on all these features. So how do we know what each of these particular positions of all these joints are? And I'm not talking about in terms of memorizing. I'm talking about how we even came about with the answer of how these exist. Well, it's all based on research. Some other really smart clinicians and researchers already did the work for us. They're the ones that studied anatomy and biomechanics, and they found the answer. So as annoying as it is for us to have to sit down and, make some flashcards to memorize these things, I'd say what we're doing is a lot easier than going through with all this research to find out these answers. Now, what about the application for this concept? We don't just learn things just to learn it. We can actually apply it for when we are in the clinic. Well, we can apply this for when we are examining our patient, we're testing them, when we are performing joint mobilizations, and also can help us reason why people place themselves in certain positions following injuries or surgeries. So let's talk about how it helps with examining a patient. I want you to think about the knee joint again. So let's say that your patient is coming in for an injury and you are here to help them either rule in or rule out that there is a ligament tear. And let's say specifically the ligaments on the lateral aspects of the knee joint, so the MCL, LCL. So there are two ways to test these lateral ligaments. So the first one is with the knee joint extended completely and you apply a valgus or varus force. Then the second way is to slightly flex the joint and then apply the same valgus or varus force. So even without thinking about the open pack position and applying the concept here, if you've tried this out, you should know and have felt that if you apply a valgus or varus force on an extended knee, it really doesn't budge. And that's because all the surrounding tissue structures are tight, they are taut. But if you slightly flex the knee and then you apply a valgus or varus force, so even on a person who has not been injured, you're going to be able to feel that the patient's knee moves a little bit more than if it were in that extended position. And that's because in this position, the patient's soft tissue structures surrounding the joint are in a more relaxed position. And then how you can tell whether or not there is a tear is by, comparing it to the other side along with their subjective complaints and other objective findings. But that's besides the point. Now let's actually apply the concept of the open pack position into what we had just given an example of. So again, let's say this person comes to you with a knee injury and you're trying to see if there's a tear. Well, in the first test, you're going to have their knee extended. And when you're applying a medial to lateral force to assess the integrity of the LCL, because your patient's knee is extended, this is a position where the surrounding soft tissue structures of the joint are tight. So even if they do have an LCL tear, the structures surrounding it might be holding the knee in place just enough to where you're not really going to notice a huge discrepancy between the affected leg and the unaffected leg. But now you decide to make sure, and you're going to place your patient's knee in that slightly flexed position. So now in this position, which wink wink happens to be the open pack position where the surrounding structures are in a lax state, there's going to be more give when you apply that medial to lateral force to assess, again, the integrity of the LCL. So here you're going to feel how loose the knee actually is if the LCL is torn. So in this slightly flexed open pack position, we're going to have a looser position that allows us to physically push farther and really see how far it can go. So we can take advantage of our knowledge about the open pack position and implement it while we do our special tests and just tests in general. Next, we can also use this knowledge to our advantage with joint mobilizations. There's a reason why we do shoulder joint mobilizations in certain positions. So we place ourselves between the patient's torso and their arm, and being in this position, it is close enough to placing our patient's shoulder in an open pack position. If our joint is already really tight, such as with frozen shoulder or adhesive capsulitis, Why would I want to put this shoulder into a tight position and then try to push it? Wouldn't you think that having this tight shoulder in the loosest position, that this might be the most optimal to actually push through it a little bit? So that's the concept. Then lastly, open pack position and injuries. If you have an injury and there is swelling involved, where does all that swelling go? Generally, you're going to see it surrounding the joint. Well, if I have a lot of fluid accumulated in one area, this creates literal pressure, and pressure hurts because it's squeezing all of those nerves, and nerves are what tell our brain that something hurts. So we're naturally going to position our joints in a way that is going to open up the compression that we feel to allow the most amount of space for that fluid to be in. This is going to be that open pack positions. I want space between my bones, space that is created by the laxity of the capsular fibers, of the surrounding ligaments, of the surrounding soft tissue structures. If these things are really tight and it's extremely taut, that decreases the space. However, just because the space is decreased doesn't mean that there's not as much fluid as there was before. The fluid does not go away, so it just feels worse in an even more enclosed space. So just keep in mind that, just because it feels better doesn't mean that you should tell your patients and educate them that they should stay in these open pack positions. Let's say that your patient just had a knee surgery. So there's expectedly going to be a lot of swelling involved. It's natural. But you don't want to let your patient just stay in that 25 degrees of flexion because it feels good. Because if they do that for long enough, it's going to be really hard to get that range of motion that we want into knee extension. They're going to be stuck in that 25 degrees of flexion if they don't force themselves into that uncomfortable knee extension. So just some food for thought. It might feel comfortable, but that might not necessarily be the best thing for your patient. However, with all this information, about the open pack position, it can really help us in guiding our critical thinking and thought processes, whether it's assessing or treating our patients. If you enjoy being taught content in this way, check out our courses at sptwithme.com when you're studying for the NPTE.